I'm Joe Reed from HMENews, and we're here at MedTrade 2011. We're in the booth of Renewal Technologies, and standing next to me is Lance Hoeltke, Vice President of Sales. I'd like to know a little bit more about the history of the company and what you folks are doing here.
Certainly, thank you. The company really starts with the product. LaserTouchOne is all we manufacture and represent. Our vision is to connect millions of people in pain to this medical device that we believe is a real breakthrough. It starts with our medical director and the developer of this device, Dr. Aki Wee. Dr. Wee's been practicing as an MD for nearly 40 years. He's been operating out of Scottsdale, Arizona since 1984, and he was really an early adopter of the modalities that are contained within this device, namely microcurrent and cold laser. And in the early 2000s, he had the opportunity to develop this device by combining the two into a handheld tool, and what the device is able to do is stimulate cells and facilitate repair and healing of tissue at the cellular level. Many milestones were reached before we launched the company to bring national distribution of this product, and that actually capstoned with an FDA clearance for over-the-counter use, which we obtained in April of 2010. So in July of 2010, about 15 months ago, we launched Renewal Technologies, and our vision is to connect millions of people in pain to LaserTouchOne. We do this through distributors who receive extensive training, access to territory, marketing materials, a web page and business portal to transact business through, presentation, demonstration supplies, access to inventory, and ongoing support. We're at about 115 distributors and counting. We grow every month. We've done about 5,000 unit sales to date, and we're in about 90 markets, but lots of room to grow here. So the company is young, but we have a product that's quite a differentiator in an enormous marketplace that is in high demand for a pain relief product such as LaserTouchOne.
Now, you were talking about distributors. How does that apply to the HME provider?
Certainly. So, given everything we know about competitive bidding and the pressures of healthcare reform, the changes that are occurring in this industry, here we have an over-the-counter cleared device by the FDA that is very suitable for both health professional and consumer use and has such a wide range of applications for use. We're FDA cleared for acute, post-traumatic, post-surgical, and chronic intractable pain of musculoskeletal origin. So from headaches to plantar fasciitis to fibromyalgia, RA, MS, Parkinson's, neuropathy. There's so much versatility with this tool. It's ideally suited for the consumers and the business partners that interact with these HME organizations on a daily basis and have a need for a device like this that involves no drugs, no side effects, virtually no risk, and is over 90% successful in delivering statistically significant pain relief. So a nice fit to the portfolio of products that these organizations are looking for to diversify, to sell something that can be purchased by the consumer and has such a success rate. And again, a market that has over 116 million Americans here in the States alone suffer with some sort of chronic pain. So big marketplace, a very a product that is a differentiator, very successful, and again ideally suited for these types of organizations to market to their clients and customers.
Do you also feel that some of these HME providers are going to be going outside maybe of the realm that you have perceived it? To me, they're going to go to hospitals, hospices, home care agencies. Is there anybody else that they're going to be outreaching in their community?
Many pathways to people in pain. And so a device like this, which can be used in a professional setting, and we've seen PTs, OTs, chiros, podiatrists, we even have some orthopedists and other specialists who use the device in practice on a daily basis. So we see great receptivity in the healthcare profession, but we also see a lot of receptivity in the consumer space. And so an HME company, yes, can take this through any personal or business relationships that they have or would like to develop around a product like this.
Lisa just had a treatment, and I'd like to ask her what her experience was, how she's feeling now.
Treatment was great. I felt like I was having a massage at an expensive spa. It was no pain involved. It was great. It only lasted 2 minutes. I have chronic fibromyalgia and my neck feels great after 2 minutes.
Now, if somebody's interested, how do they contact you folks?
Certainly. So we have a very robust website at www.lasertouchone.com. You can also go to renewaltechnologies.com, and there's an opportunity there to request more information electronically. There's also our contact phone information, which will likely make its way back to me to answer any specific questions that you may have. And it's been a lot of fun. I spend most of the day interacting with qualified and capable distributors who are looking to add a product like this to their portfolio for a variety of reasons.
Well, thank you. We appreciate your time very much. This is Joe Reed from HME News, MedTrade 2011.